Questions that gets asked, or one of the real world examples that gets asked when we talk about the vaccine conversation, is this measles outbreak that's been happening. Casey Means got asked about it. She sort of hedged on some things, but here's Dr. Sapphire. This is on Fox News back in December, sort of during the height of the measles outbreak in South Carolina.
Because of the mishandling of COVID, we started to see even a bigger decline in vaccination rates. Unfortunately, the way things are going right now with the CDC and the current vaccination advisory committees, we're seeing even more mistrust and confusion. And so I expect that we're going to see further declines in vaccination rates, and we're going to see more measles cases.
In your mind, how does a Surgeon General confront the misinformation that's out there, confront the hesitancy that maybe some parents do have when it comes to vaccines?
They really have to have very clear messaging that, science and the scientific process is validated, right? And we've studied vaccines for years, right? The measles vaccine came out in the 60s. And so they really have to be very clear about how, vaccines, medicines, and so many other things come to market after years of research for safety. And I think they have to be very clear about that, and just very steadfast kind of in their wording and their messaging, and honestly put that first when it comes to their role as a Surgeon General.
In your opinion, over the last year, given all of these controversies we've had with public health, do you think there has been a degradation in public health? And if so, do you think this nominee might be able to begin remedying that?
I 100% feel that there's been a degradation. And I think the biggest degradation comes from the trust in the healthcare system, right? So the rate of trust in healthcare professionals, specifically physicians, has actually declined over the past few years. And that decline has actually become more steep during the COVID pandemic. So that really scares me. I think that this current nominee, I'm glad that she's a practicing physician. Obviously, she practices, evidence-based medicine on a daily basis. She works at a reputable institution. So I do feel, more hope with her than I do with Means. I think that time will tell in terms of, where she truly stands. And she has some kind of, political affiliation and things like that in her previous statements. And so I do think that it's going to take some time to tell.
She is also known to be on social media. I don't necessarily want to call her a medical influencer, but she gives what she calls science-based advice. But some of the things that she has said on social media have been controversial. One of them being, the biggest issue that we have in our healthcare is that folks aren't taking care of themselves, and the things that they're showing up to the doctor's offices for are wholly preventable, sort of this individual responsibility. When it comes to the communication part of it, obviously you said she needs to be clear. Can she use social media to her advantage, to the advantage of the Surgeon General's office, to explain to people what is going on, what is scientifically based medicine?
I do think that in this day and age, there is a role, right, for social media. And I think that that's just the shift that, we've come to. Obviously, there's so many questions about kind of how it's used and the algorithms and how it's influenced and how it can be kind of taken in a different direction. So that does concern me. But I do think that not only can it be used, but I think it's going to be regardless of, whatever I say or what is right, I guess.
Let me ask you something. For people who have lost trust, not just in the medical profession, but at our health agencies in the United States, which were the creme de la creme of the world, right? And they're suspect of so many things. What would you have to say to them?
I would say that we came into medicine, and I would argue that, people that come into political office probably have a similar kind of notion. They come in with the hope that they want to help people. And I understand that, kind of the decline and just kind of what is happening right now with the political climate makes it really hard for people to trust us. But, our kind of initial entry point into this profession is that I want to help people. I want to make people feel better. And so I really hope that alone can kind of just instill a trust a little bit more,
All right. We will have to leave it there. Dr. Mansi Kotwal, pediatrician and board member for Healthcare for Action. Come back and see us when they have the confirmation here. We'll talk about it.
Thank you so much. Appreciate it.
Thank you.